The Bismarck Model in Japan. In 1883, Otto von Bismarck created the Bismarck Model as a social welfare system for German unification. He designed the first elderly social insurance program. His national health care model was based on three principles. The government is responsible for universal access to health care. Health policy is implemented by the smallest political and administrative units in society. Elected government officials negotiate the terms of medical care and reflect on the interests of different medical professions. Bismarck really wanted to ensure the people of his country that they receive health care and the well being of workers in order to keep the economy operating at maximum efficiency. The Bismarck model, which is often referred to as the social health insurance model, this system charges fees based on your income to provide the entire population with health care. Health insurance is mandatory for all citizens and is financed jointly by employees and employers. It essentially operates on the principle of social solidarity, where the healthier and wealthier individuals help support those who are less fortunate, which means those making $10,000 a month are paying a slight bit more than someone paying $4,000 a month. These contributions from the citizens are used to provide healthcare coverage to the entire population, ensuring that everyone has access to essential medical services. The government tends to establish a central healthcare fund to reimburse healthcare providers. For the Bismarck model, healthcare is considered a social right, and the government plays a significant role in regulating and overseeing the system. The Bismarck model is a free access system that allows people to be examined and treated at the medical institution of their choice, regardless of their symptoms. The Bismarck model in Japan is known for their high quality and efficient healthcare. They have two different main types of insurance systems, which are employees' health insurance system and national health insurance. What I found interesting about the Bismarck model in Japan specifically is that all residents receive health care, citizens and non-citizens. If they live in Japan, you can receive health care. To ensure all residents receive care, people who are disabled and cannot work receive help from the state.
So in this video, I wanted to talk about Japanese healthcare, medical costs, and my experience in the last 15 years living in Japan. So the other day, my wife, Maiko, told me that she had to go to the doctor because she had a cold. I asked her, didn't you just go like a few days ago? She said, yeah, but that was for a skin rash. And then I asked, didn't you go a week before that? And she said, yeah, but that's different. That was for a stomach ache. For me, someone that grew up in the States, that's kind of a lot of doctor visits. I might go for a severe skin rash, but not for a cold or a stomach ache, which got me thinking about Japanese healthcare in general and why people in Japan go to the doctor so much compared to other countries like the US. I mean, how is it in your country? Does everyone go to the doctor for every little minor ailment? And what's the reasoning behind it? Anyway, let me explain the basic Japanese healthcare system. For those of you who don't know, Japan was ranked 11th out of 195 countries in the HAQ rankings. The Japanese healthcare system is considered universal because it's supposed to cover everyone in Japan. So anyone living in the country, even a foreigner like myself, have to pay into the system. So insurance covers 70 to 90% of all necessary doctor visits. And one of the things I appreciate about the Japan healthcare system is you don't have to pay the full amount of your medical bill up front and then later fill out some paperwork to claim a refund. Perfect for someone like me who hates paperwork. So all you need to do when you arrive at the hospital clinic is show your healthcare card. Actually, I have one in my pocket right now. Actually, I don't have it. It's in... Alright, here it is. It has all my information, so I can't actually show you what's inside, but I pretty much carry around with me everywhere, just in case. You never know. And so what's nice, at the end of your visit, the hospital will calculate how much you need to pay, and you're good to go. And to be honest, it's surprisingly cheap. I'll get into the actual cost in a few moments. So again, people only pay about 30% of the total hospital bill, and sometimes it can be reduced down to 10%, depending on other reasons. And your monthly health insurance varies depending on your age, income, type of work, and where you live. And there are 3 main healthcare systems in Japan. 1 for company employees, 2 for civil servants, teachers, and public workers, and a 3rd national insurance for everyone else. They all have pretty much the same coverage, but if you're an employee, the company has to pay half of your health insurance, which is awesome for most Japanese people. So for example, let's do this in US dollars so it's easier to reference. If you're under 39 years old and you work a regular job in Tokyo and you make $2,400 a month, you only pay $120 for your insurance. Now, if you make $5,000, you pay about $350. And say you're making the big bucks and you're making $10,000 a month, you're paying about $525 in insurance. I don't know, I think that's pretty reasonable. What do you guys think? And how much do you guys pay for your monthly healthcare insurance? And now more to the point, and why Michael goes to the hospital so many times. Here are some regular doctor visits that I've had. So my knee was bothering me after playing some basketball. I went to the doctor for an examination and got 3 x-rays. The total fee was $11, and the 3 x-rays only cost $2.50. Another time, I had a doctor consultation to pick up some medication, and it only cost me $3.50 to consult with the doctor. Can you guys see now why Michael goes to the doctor so much? It's just so cheap, relatively speaking. Knowing those numbers, it makes so much more sense to me why Japanese people go to the hospital or go to the clinic for every little sickness or illness or whatever happens, they just go see the doctor. Another perk about having company health insurance is that they offer free annual health checkups. It's funny though because health examinations become a yearly talking point for many Japanese employees. Employees ask each other if they've taken it yet. Regardless, it's that time of the year because you get spammed by HR telling you to take your test. So anyway, let me break it down. So the basic annual health exam is called the Kenko Shindan. Again, it's free for most employees. The exam checks things like your eyesight, hearing, blood, chest x-rays, urinalysis, etc. just to make sure your body is working as it should. And if anything is out of whack, you can catch it early on. There's actually a more comprehensive exam. It's called the Ningen Do. It's free if you're on the company insurance and you're over 35 years old. These additional tests include things like respiratory function, stool tests, more detailed blood work, etc. Then you can add extra examinations on top of these at your own cost. In my case, I wanted to really check things out, so I actually got CT scans for my head and chest. This set me back $320. But if you just took the standard examinations and you're on the company insurance, then it's all free. To me, that's pretty amazing. But what do you guys think? How much would these examinations cost in your country? Alright, now let me talk about something a little more serious. I haven't mentioned this before, but in 2012, I was in a serious snowboarding accident here in Japan. I ended up with internal organ damage, a collapsed lung, a broken hip, 9 broken ribs. It caused an aortic aneurysm. I ended up in the emergency room in Nagano of all places, and I was in the ICU for about 20 days. Now how much do you guys think that hospital bill would come to? Well, it came out cheaper than I ever expected. It only cost $1,500 to save my life, which I'm super thankful for. And then after about 20 days at Nagano, I was transferred into a hospital in Tokyo. I spent about another 40 days in and out of the Tokyo hospital, and I had to have open heart surgery for my aortic aneurysm. And so at the end of the day, the open heart surgery and the 40-day stay in the hospital and came out to be $4,800. It felt quite expensive at the time, but compared to other parts of the world and the quality of healthcare I received here in Japan, it was so worth it. In fact, another feature of the Japanese healthcare system is something called Major Medical Expense Supply, which basically means that if your monthly medical bills get to a certain threshold, then the government will pay you back some of the money. This pretty much ensures that no one goes bankrupt if they get sick here in Japan, which is another cool thing. But luckily in my case, I never got to that point. So in my previous video, you probably already know that Michael and I recently got married. I have American citizenship, so we've actually considered moving back to the States. But one of the scary things for us is the US healthcare, especially now that we're thinking about starting a family. The thing is, I have a friend in the US that was recently hospitalized. He wasn't feeling well and got really sick and had to spend 7 days in the hospital so they could run tests and so that he could recover. The medical bill after the entire ordeal cost $70,000 for those 7 days. That's $10,000 per day. That's insane. There's no way I'd be able to afford getting sick in the US, let alone my family. Probably the reason why I never went to the doctor when I was growing up for a cold or even a stomach ache. It was just way too expensive. And probably the reason why Maiko, although she was healthy growing up, has so many memories of always visiting the doctor. So anyway, let me know what you guys think of the medical costs in Japan, what you think about the healthcare system here compared to your country, and let me know if you prefer it over your country. And like so in this video, I wanted to talk.
The problems in the Japanese healthcare system are the shortage of healthcare providers, especially in rural areas. Nearly 70% of hospitals and clinics are suffering from labor shortages. A career in healthcare in Japan is seen as less enticing now because of the low wages and heavy workload. The Japan Times did a survey covering 19,890 employees of caregiving facilities and 66 and that showed 66% of nursing homes were experiencing labor shortages, meaning a large number of aging patients won't receive the care that they need. Also, the advancements in healthcare treatments are raising the cost, and it's hard for the government to keep up. Balancing cost control while maintaining high quality care is another ongoing problem Japan is facing. Now, comparing Japan's healthcare statistics with Germany, the life expectancy for Japan is averaged at 84 years old right now, while Germany is at 81. In the infant mortality rate of Japan, which is the amount of infant deaths per 1,000 babies born, is at 2, while Germany is at 2.1. And the leading causes of death in Japan and Germany, actually, and France, I'm pretty sure, is ischemic heart disease. And then in France, the life expectancy is averaged at 82 years old, and the infant mortality rate is at 2.7 deaths per 1,000 babies born. And in the Netherlands, the life expectancy is at 81 years old, and the infant mortality rate is at 2.1 per 1,000 babies born. And the leading cause of death is Alzheimer's disease and other dementias. The cultural differences in Japan are the price differences from American healthcare, which is very drastic. They have a 50% lower cost on healthcare compared to the United States right now. Then the predominantly more male physicians is a cultural difference, meaning Japanese people may be more accustomed and comfortable with male doctors rather than female. Then the freedom for patients to have access to any healthcare provider. Most Americans worry about their bill when receiving care, but Japanese healthcare providers provides the same quality no matter the hospital or clinic, so you don't really have to worry. Lastly, the Japanese culture has a strong emphasis on supporting healthy lifestyles and preventing disease. They find shaking hands, hugging, and all forms of PDA like kind of disturbing. They encourage social distancing on regular. Respecting the Japanese cultural differences can start by providing more training for healthcare providers in order to increase cultural awareness and knowledge. It's very important for healthcare providers to keep up on cultural differences and knowledge since they deal with all types of people from very different backgrounds. It's also important to have interpreters in your hospital or clinic to ensure everybody is understood. Lastly, including family members in healthcare discussions when the patients are young or elderly are very important so family beliefs are still respected. In conclusion, Japanese healthcare with its universal coverage and emphasis on preventative care is generally well regarded. Not many complaints are made due to the efficient health insurance system. However, the workforce shortage and balancing between cost control and quality care remains a pivotal challenge for Japan's healthcare system. finally, exploring cultural differences in the healthcare system reveals the richness of human diversity. Embracing cultural differences offers opportunities for growth, learning, and mutual understanding in the healthcare system. Thank you so much for listening.